The opinions expressed in the following program are not necessarily those of Eastlink TV, its sponsors, or partners.
Welcome to Your Health, a new program here on Eastlink exploring issues of healthcare and good, healthy living in Greater Sudbury, Northeastern Ontario, and I'm your host, Dan Lassard. February is Heart and Stroke Month in Canada and in Northeastern Ontario, so we thought we'd dedicate the first program of Your Health to issues regarding heart health. And joining me to talk about that is John Binks. He is the Community Mission Specialist for the Heart and Stroke Foundation in the Sudbury office. John, thanks for joining us.
Thank you.
And Kate Blanchette, who is the Clinical Manager of the Cardiac Rehabilitation Program of Health Sciences North, based out of the Centre for Life YMCA building in downtown Sudbury. Kate, thanks for coming.
You're welcome, Dan. Thank you.
Thank you both for joining me to talk about matters of good heart health. And John, I want to begin with you. From the statistics collected by the Heart and Stroke Foundation, just how prevalent is heart disease and heart illness in Greater Sudbury and Northeastern Ontario?
Well, when you look at the Northeastern stats, Dan, our level of heart disease comes in around 8%, whereas Ontario as a whole is only 4.7. So it just shows that we have a significant issue here in Northeastern Ontario.
I think over the years there's been a number of factors linked to that higher rate of heart disease and heart illness in Greater Sudbury and Northeastern Ontario, but can you just recap some of the reasons why we have a higher rate?
Well, some of the reasons would be our diet, our smoking behaviors, our level of physical activity. We tend to be sedentary. And also the issue of blood pressure. Our blood pressure in Northeastern Ontario tends to be higher than other places in Ontario.
Which can be caused by, I guess, diet and also stress.
Absolutely.
Stress levels, hypertension.
Absolutely.
The Heart and Stroke Foundation has a number of commercials out now that are really quite powerful, and those commercials talk about a shifting demographic when it comes to heart disease and heart illness. What can you tell me about that?
Well, heart disease has often been stated that heart disease is a disease of old white men, and unfortunately that's not the case. We are seeing an increase in the level of heart disease and heart attacks in women. We're also seeing it in people that are of a lower socioeconomic background. And finally, with children, we are seeing our young people developing some pretty major risk factors, such as type 2 diabetes, blood pressure, high cholesterol, that sort of thing.
Kate Blanchette, you were nodding when John was saying that. You are the clinical manager for the Cardiac Rehab Program at Health Sciences North.
That's correct.
Are you seeing that? Are you seeing a shifting in the demographics of heart disease and illness, and also just a greater caseload?
Absolutely. We are seeing our caseload has significantly increased over the last decade. I would say probably close to 40 to 50% in terms of patient volumes referred to the program. As related to demographics, I definitely would agree in that we are seeing a younger population, as young as people in their 20s and 30s that are coming to us for secondary prevention, meaning that they've had some form of cardiac intervention or disease that's been diagnosed. We're also seeing older people in that they have had 2 and 3 and 4 surgical interventions, for example, and have come back to visit our programs. So the range of age has really expanded. Where we used to see on average folks in their 60s, we're now seeing people within the age group of 30 to 90. And we're also seeing a gender shift in that we're seeing more women than we ever have before.
John was mentioning just a moment ago some of the risk factors linked to heart disease that someone might not think would have anything to do with heart disease initially, such as diabetes. Do you think there's a misconception on the part of people who say, I don't have heart disease, there's not a history of heart disease in my family, but they have other risk factors that makes them candidates for heart disease? Is that something you have to deal with as well?
Certainly, we do see people that come into the program, and even though, unfortunately, they've had a cardiac event, there's still an element of denial or misconception or misunderstanding about the classic risk factors. And certainly when one has obesity, that increases the risk for both diabetes, hypertension, and high cholesterol. And second to that, it's a vicious cycle. There comes the risk for a second coronary event. So it's all intertwined for sure.
Now that's a good question, the question of obesity and being overweight. How do you determine if you're overweight or obese? How can you get a good, accurate depiction of that?
Well, there are classic markers that a clinician would look for to determine whether somebody is overweight. And then there's different levels of obesity. But generally speaking, we would look at something that's called the body mass index. And it's a simple calculation of looking at your weight versus your height. But with that particular measure, it doesn't take into account the structure of one's body. So if you're more muscularly fit, you may weigh more, but not necessarily or obese regarding that number that may be out of range. What we like to look at is where in relation to your overall body and stature is the weight stored. And we do a measure that's called the abdominal girth. And if the abdominal girth for men is greater than 102 centimeters or 88 centimeters for women, then that puts you at a risk for heart disease because that displays an excessive weight or obesity in the abdominal area.
Now there is a proper way to measure abdominal girth, and I believe that's on the Heart and Stroke website. Tell us a little bit about that.
It is, Dan. You know, if you go to our website, there is a video on there that actually demonstrates how to do it, and it's really quite simple. It's taking your abdominal girth at the widest point, and where that is right around the back and right across the belly button. So there's no cheating. You can't go down low or you can't go up high.
A lot of us like to go from the top of the pants. That's not the way it's supposed to be done.
That's correct.
Right across the belly button.
Right across the belly button.
There's something else interesting on your website, and we should say that is heartandstroke.on.ca.
Correct.
There is a risk assessment tool that people can take there to see their risk of heart disease. Tell us a little bit about that.
Well, if you go to the website and get on to the risk assessment, and it's very easy to find, it's on the landing page, we look at a number of indicators that we analyze and then determine what the risk of an individual is. And it is individual. I want to stress that. So we look at some of the uncontrollable risk factors, we look at some of the social determinants of health, we look at the controllable risk factors, so we're looking at smoking behaviors and weight and height and all of that sort of thing. Once that's all inputted into the computer program, then you receive a document that will rate your risks and also point out where you can get additional help.
I did take that risk assessment in preparation for this, and I think if you have more indicators in green, you're doing well.
That's correct.
Okay. Kate, when someone comes to you, they do have a cardiac issue. They have had an episode with their health in terms of their heart care, and they come to the Cardiac Rehab Program. What do you do, and how do you do it?
Well, first off, the patients are assigned a case manager, and the cornerstone of cardiac rehab is chronic disease management. So it's not as though we're only looking at one particular area and providing counsel and exercise program education as related to, let's say, for example, their high cholesterol. We look at the whole patient picture. And heart disease is lifelong, and there's no silver bullet or magic bullet and quick fix. And so our philosophy is to ensure that a chronic disease management perspective lays the foundation of the care that we're delivering. So the patients are assigned a case manager, and we're a multidisciplinary team of nurse practitioners, nurses, physiotherapists, kinesiologists, dietitians, psychological associates. So it's a team approach. And what is important is to identify the patient's risk factors in light of preventing a second coronary event. And once we've identified those, it's important that the patient has the skill set or the tools to go forward in life to make sure that they are reducing the risk as much as they can. So with that said, it's important to set goals, and really the patient needs to take that upon themselves with gentle guidance from our counselors and our disciplines. But we really do try and take that chronic disease approach. We have individual counseling, one-on-one group sessions for all the classic risk factor management. We have nutrition counseling. We have vocational assessment. We also have a workshop that's called Optimizing Life that's offered to the patients, and that's specific to chronic disease management. We have smoking cessation counselors on our staff, psychological associate, as I've mentioned, to help our folks deal with stress, anxiety, and depression. And of course, there's the whole block of exercise. And exercise is really a science, and these folks need to know that because of the medication and the particular cardiovascular limitations that they may or may not have, their exercise needs to be prescribed to them scientifically. So there's a lot to the program.
For people listening at home who have not come to that point where they need that kind of intervention, they might be wondering, how much exercise do I need? What are the kinds of foods I should eat so I don't get into that situation in the first place? Can both of you offer advice, some best practices in terms of diet and exercise, standards to follow?
Well, Dan, just recently a new physical activity guidelines have been put out, and what they're saying is 150 minutes per week of moderate activity. Moderate activity would be a brisk walk, for example. Now, if you do more than that, it's better, but that's what you should do at a minimum. The other thing is to look at things like diet, and if you're a smoker, you need to quit.
Diet. Kate, what are some best practices or principles people should consider?
Well, obviously following Canada's food guide. It's again, no simple fix. Many people have other comorbids such as thyroid disease or diabetes, or celiac disease, or other gastrointestinal disorders. So we have to look at the overall picture of how people present. But generally speaking, following the Canada's food guide is a great place to start. Low sodium. Everything in moderation in terms of alcohol and caffeine intake, and certainly low fat, high fiber. I'm not a dietitian, but I think that just common sense nutritional choices that are in moderation is best.
And go online and get the Canada Food Guide to give you some of the guidance in terms of that.
Yeah. Feed yourself like your mother used to feed you.
That's always good advice, especially if your mom was a great cook.
Yeah.
We have just a couple of minutes left, so to both of you, you have about a minute or so to answer this question. What are you doing for Heart and Stroke Month? Because February is Heart and Stroke Awareness Month. John, what's the Heart and Stroke Foundation doing?
Well, number one, February is our time to do our person-to-person campaign, door-to-door. And, in Northeastern Ontario, we've got about 4,000 volunteers that are going to be out knocking on doors over the next month. So we hope that people are going to open their door, accept the information that's given to them, and possibly donate.
Okay, Kate?
In terms of cardiac rehab, every year there is a annual national cardiac rehab, which is the second week in February. So we do a lot of in-house promotion with our participants and our staff and the families, and getting them pumped up regarding the importance of cardiac rehab. But we're also taking up collection in-house, and we're having a dress down day, in fact, next Friday amongst the staff, and we do a little bit of a collection there to support the Heart and Stroke Foundation as well.
Oh, wonderful.
If people would like more information about your programs and organizations, how can they get a hold of you?
Well, they can get a hold of me by calling 705-673-2228. Just ask for me, and we'll work from there.
And that's heartandstroke.on.ca.
That's correct.
And Kate, if people want information about your program, they
right,
can go to the
if
website.
you go to our website, which is www.hsnsudbury.ca, and click on Program Services, choose the Critical Care area, you'll find the Cardiac Rehab website, which is very comprehensive. All of our information is there, including referral forms. We do have automatic referral, so if you've been in the hospital within the last 3 months, we'll be calling you. But if you haven't had a recent hospitalization, you can download our referral and have your physician sign it. And our phone number is 705-671-6600.
I want to thank you both so much for coming in to launch this new feature, Your Health. Thanks so much.
Thank you.
Thank you. It was a pleasure.
That is John Binks of the Heart and Stroke Foundation in Sudbury, and Kate Blanchette with Health Sciences North, the Cardiac Rehab Program in Sudbury. I'm Dan Lessard. This has been Your Health. Thanks for watching.